that I want to remind everybody, because people easily forget that health is a public good. And I move from that assertion. It's a public good and not just any other commodity. It will be quite unfortunate if we work within healthcare and you want to challenge that health is a public good. It's not a public good in a communist country, in a socialist country, or a capitalist country. In all countries of the world. And that's why the World Health Organization came with the Alma Ata Declaration for those who don't work within the health sphere. Alma Ata is a small town in the former Soviet Union. It is now in the state of Kazakhstan. Yes. In 1978, the World Organization met in Alma Ata and decided to redefine health afresh. And they came with a new definition that said health is not just the absence of disease or infirmity, but is a state of good physical, mental, and social well-being. I didn't put it there. That was a new definition of health, that you need to look at the social aspect, you need to look at the mental aspect. It's not just because somebody's sick, it's not lying in hospital, then there is health. And they went on to say, I thought I didn't put it there about the absence of disease. It actually appears. And they went on to say the attainment of the highest standard of health is the most important worldwide social goal, whose realization needs action from other sectors, economic and social, in addition to the health sector. It's the most important worldwide social goal that we must all pursue. Many people might remember, of my age group, of course, that Alma Ata Declaration ended up by saying health for all by the year 2000. In 1978, we thought 2000 was a millennium away. I remember I was a first-year medical student. I thought it was never going to arrive. The bad news that it came and went, and health became much worse than when the declaration was taken. The health of the world went in the opposite direction. In our country, we can definitely say so yet. There are more women dying in pregnancy and childbirth than there were at that time, and there are more children dying before the age of 5. In the Department of Health, we said these are the 4 outcomes. We said if the country can achieve this, you'll see massive changes. That issue of health being a failure will become history. To increase life expectancy. Life expectancy in South Africa has taken a knock because of the quadruple burden of disease. It said that in 2015, our life expectancy will be where it was by 1955, if we don't do something drastic. Decreasing maternal and child mortality, very obvious. Combating HIV/AIDS and decreasing the burden of this on TBS. Then the strengthening of the healthcare system. There are 5 areas there. I didn't put them there, but which are important. Firstly is infrastructure. Secondly is HR. Thirdly is the quality of healthcare services. Fourthly is the re-engineering of the primary healthcare. And fifthly is the cost of healthcare. The country needs to deal with those 5 things. If we deal with them thoroughly, the health system will become effective. At the moment, the healthcare system is not effective at all. If you look at these maps, you realize that Europe and the part of the developed world are busy making health accessible to the public. Africa, the poorest continent, is busy privatizing health. And there's nothing wrong in private. People misunderstand me every time when I talk about the issue of private health. It's not a fight against private health. It's an assertion that health as a public good must be provided publicly for the majority of the people. Those who can go private, it can be a primary platform of provision. It's like education. You can't say the children of the country their parents must find a way to educate them privately. It has to be the duty of the state. It's like welfare. Yes, that's what Sierra Leone is doing. And in the African continent where we are supposed to be rich, look at South Africa. That is us there. We're number 24. We're still worse. The only other country that is imitating us is Namibia. I don't know whether it's because of proximity. If you look at Angola, yes, they are moving towards what Cuba is doing. If you look at Angola, if you look at even Equatorial Guinea, Botswana, Djibouti, they are all trying their best. We're the only ones who are doing something that is abnormal. And yet when you want to change it, people argue. I want you to engage with the rest of the world when you change these things. because we're not going to do what Sierra Leone is doing. How do we run a government and tell people that, you know, yes, because the people will say every man for himself and God for us all. But what we are doing in South Africa is not that, every man for himself and God for us all. It's every man for himself and the devil take the hindmost. That's what we are doing in healthcare system. And we need to reverse that, and that's exactly what NHI wants to achieve. Thank you.
And as I said, I'm going to choose Dr. Chris Archer as the first of the panelists to come and speak for two reasons. One is, of course, Chris is the elder amongst this group of panelists. And we always respect the elders, right? Is that right, Minister? The second is there's always a feeling, actually, and I think sometimes borne out in practice. The Minister himself, actually, in the last several weeks has put all these major adverts in the papers looking for new CEOs of hospitals and to an extent insisting that they've got to be doctors. So there's a feeling amongst the doctor profession, not the nursing profession, that as one study at Chris Hani indicated, that doctors could actually, in terms of responsibility, could be put into a closet because that's as much responsibility that they're given in the healthcare system. Now, of course, we have a Minister of Health and a doctor at that, so some of us hope that that